Are you tired of the quick fixes that promise transformation but leave you feeling more disconnected from your body than ever? Welcome to the Beyond Medicine Humanized Care for Women of Influence, where we go deeper than those surface level solutions. I am Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. Here, we will uncover the root cause of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body's not a microwave, it deserves personalized, compassionate care that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. And today I have with me in the show Dr. Sean. So I am going to allow her to introduce herself and tell us a little bit about what you do and how is it that you help people. And then tell us something fun about you as a person that goes beyond what you do or your job. Welcome to the show.
Well, thanks for having me. As mentioned, I'm Dr. Sean. My last name is Johnson. I'm born and raised Houston, Texas. I'm graduated from Jack Yates High School, and I've basically done all of my training in Texas. I went to Southwest Texas State, which is now Texas State, UT Southwestern in Dallas for medical school, and actually did my residency in El Paso in association with the the Army. I became a member of the United States Army when I accepted the health profession scholarship in medical school. So I did almost 10 years on active duty. And that's where I got my orthopedic training, obviously. Right now, I am in private practice in Houston, Texas, not something that I thought I would be saying at the age of 48. But as life would have it, that's where we are now. And I'm actually really enjoying the flexibility that I have. I call it flexibility without consistency, which kind of goes together, but the consistency is the financial part, right? The flexibility is the part where I get to choose what I'm doing day in and day out, essentially, which makes me a lot happier than I was even when the pay was consistent. So I'm happy to be in the role that I'm in right now. So as an orthopedist, I specialize, I guess you could say, in sports medicine. I also have a board certification in general orthopedics, and I also do a fair amount of trauma because of my military background. I could probably be seen as more of a generalist, just all encompassing, but if I had to choose what I like to do, it would probably be a sports medicine and arthroplasty. My training was a little different in that when I did my sports fellowship, my attendings did cases anywhere from sports all the way through joint replacement. So I was able to get some training in that, which makes me a little bit different. Fun fact about me, I have a grandson and he's 3. And he keeps us busy. I'll say that. And thinking about getting into the topic of the women's life cycle, I have a grandson, but I don't have my own children. So it's been interesting. So my husband has 2 children and his daughter has a son. So I got to jump over that whole step of parenthood into grandparenthood. I'm trying to figure it out. So that keeps me on my toes. And that's probably something nobody would know about if they look me up, which is not the way we want it, but I don't mind telling people we have cadence in our life. And my main thing that I provide patients now, I provide mobile orthopedic services. I go to patients' homes who have traditional Medicare or who are fee for service paying patients. And with that, I understood that transition was going to take away from me some of the regular things that I saw in orthopedics, but the patient population that I tend to serve are elderly patients or patients with transportation limitations, busy schedules, et cetera, et cetera. So me being able to come to them and see them in their space and on their time frame is really rewarding for me. And a lot of them appreciate it. I think you remember, Dr. Maria, I had a patient that you referred to me that I came to see at your office at 6 p.m. on a, I don't know, Friday
Day of
afternoon
the
or something
week,
like that.
whatever that day of
Yes,
the week was.
whatever the iteration was, but he was very appreciative that he didn't have to miss work. He could make that appointment in his own time, and that's one of the things that I try to provide for people now.
Yeah. So thank you for sharing all of that. I didn't know that you have actually not left the state of Texas. And I'm sure that probably
Well,
for other reasons.
yeah, I did my fellowship in New Orleans. I guess I should say that. My fellowship training was in New Orleans after I got out of the military. And of course, in the military, I was all over the place.
Yeah. Yeah. So very interesting. And then I didn't know that you had that military background. I think there, I was not there. But of course, that would explain why you do have some interest in things related to like sport or conditioning, physical conditioning, because you
Mhm.
do have to have that while you were in active duty. And very interesting. I do wonder if we sit down with somebody that was a parent and now is a grandparent. 'Cause I have always heard that grandparents just they let their grandkids get away with things that they would have not their kids. And I wonder in your case, since you were not like a parent, I
Mhm.
wonder if you're like stricter or if you're
I
just
don't know. I feel like I am strict. I don't know. That's one of the things. Like I can't pull from any experience. Like I can't. I can't. I talk to my mom a lot about different things, but it's just been interesting to try to figure. And they live with us. We don't get to miss a beat over here.
oh yeah, that keeps you very entertained
Yes.
and busy besides your work.
Yeah.
Um, Thank you for being here. And today we're going to talk about a topic that I am passionate about, which is movement or staying physically active, right? Fitness in women's life, which I think that when I think of just like women's life cycle, the first thing that comes to my mind is the life cycle of you don't have your menses, then you have your menses, then you like have this weird thing going on with your menses, and then you don't have it anymore. But I think that also within this life cycle, there are certain events that some women go through, not every woman goes through, that these events might be by choice or might not. But that also is going to affect like our life cycle. And this can be you have a partner, you decide to have a kid. It can also mean even the decision if you don't work part time versus full time. And then the other things that are also there for some women, which can be you become a caregiver, whether it is a caregiver of a child with special needs or of parents, elderly parents. I hear that one specifically tends to rock the boat a lot of the time. And then for those women that have chosen to have kids, then the empty nest period can also bring some shaking in the boat. So those are things that I think of like women's life cycle, right? These events that are physiological because we are born female, but then other external events, which might be by choice or not. But so when you think about a woman's life cycle, what is it comes to your mind? And what are perhaps from that perspective of working more with like bones and thinking more about like that movement fitness that you think of that you're like, oh, these are significant events, or I have seen that these events do affect a woman's overall health and capacity to live independently. So tell us a little bit about how you see it and how you experience it.
So for me, from an orthopedic standpoint, usually people don't come to me unless something is wrong, right? I like to tell people that we also, as orthopedists, specialize in prevention and maintenance and things of that nature. And it's better to try to tackle those things ahead of time. So when I think about everything that you just said, it's easier for me and maybe some of your listeners to break it down into age groups because there's certain things that affect us when we're young women and adolescents that affect them, that affect us in early adulthood, and then pregnancy and postpartum kind of thrown in there. And then here you go with perimenopause and menopause and all those types where things like becoming a caregiver to your elderly parents come into play. And that's happening at the same time with some of the physiological changes going through. So I really do think that, like when you spoke there, caregiver, being a caregiver to your parents, how that can really be shaky, but that's usually also going on when you're in the middle of perimenopause, menopause, and just like
All
hormones.
together.
Yeah, hormones are just flying all over the place, and you're trying to figure out how to get it done. And so it really is easy for us to lose ourselves in movement and staying healthy and exercising. And I think one of the best things to remember is, and I remember Dr. Rita in your conversation, like it's not perfection that you're looking for. It's just progress, some movement and some kind of guided movement. So what I'd like to do is go through kind of each of those phases that I mentioned for people that consider things to set themselves up. And if they do these things throughout these different life cycles, then maybe we can manage some things a little bit easier, more efficiently, or more effectively, I should say, when they get piled on our plate. For us, bone density and joint health are super important. Posture, and I think all those things, when you have them and you feel strong, then your mind also feels strong. So I think that help with mental well-being. And then, of course, the things like balance to prevent falls in later life and safety, things that we don't think about when we're 25. But if we don't work on those things throughout life and maintain them, then we're 65. That little floor rug in your house becomes your enemy because if you catch your toe, you don't have your balance and then you fall. Unfortunately, I see those patients all the time who have been maintaining to their best effect, but one little thing, something they do all day, every day, then next thing you know, they have a hip fracture, and it just changes a lot of things. So as adolescents, young adults, 12 to 25 years old is where I throw those people. I like to encourage people to be active. And at that time, if you are healthy, no injuries, no anything like that, everything is A-OK by your pediatrician and primary care doctor, this is when you should really try to get after it, right? In my opinion. Weight bearing exercises, resistance activities, build bone mass early, right? Because it's going to start to go away regardless. I don't care if you have less of it, the right amount, or more. It's going to start to go away, and there's not anything we can do about it. That's one of those things that internally we can't control. As we become perimenopausal and our estrogen levels change, et cetera, bone mass is gonna go down. So whatever you can do to build it up when you're younger, should be something you want to try to do. Prioritize proper technique, cross training, early education on biomechanics and body mechanics. The one thing that I will really focus on right now in this age group, we have a lot of competitive athletes. And yes, they are exercising every day, a lot of the day, doing a lot of the same things all day, every day. That is not necessarily healthy. My young female patients that come in that are at that level, I always ask about symptoms of the female triad. Are your periods regular? Are you eating appropriately? And if they develop stress fractures, then my antennas really go up. We probably need to look a little deeper to see what your bone density is and if you are maintaining appropriately. And the way I explain that to athletes is that, yes, you want to become the next level, whatever, but you have to take care of your tool in order to do that. Your tool is your body. So if you don't take the time now, your future to become the next pro, it's just not going to happen. It's not going to come to fruition if you don't take care of your body. So I end up repeating that a lot to not just patients, but to parents, because when children are children and the parents are usually driving that train on being involved in athletics on different levels and things like that. Technique is super important, as I just discussed. And when you move in that level from different levels of competition, middle school to high school to college, I believe in participating in activities that where you retrain your body to participate at that next level. It's just because you turn 13 and now you're in the 13 and up league for softball, you automatically never try to do everything faster and harder. And that can disrupt your technique. And that can lead to overuse injuries. So you really have to pay attention to those levels. Moving on to 25 to 45. Usually that's when, of course, now we're in that working age. Things start getting really busy. We have responsibilities. We are just trying to stay above water. Maybe you got your first job out of college or out of a tech school. Maybe you just got married. Maybe you're having your first child. So I still maintain that doing something to keep your levels at a maintenance level. Strength, of course, at this point now we're thinking about the fact that bone density is going to start to decline. So you want to keep up with those resistance exercises. Preparing for pregnancy, which is important, something you discuss with your doctor. It's nice to plan those things so that we can make sure our environment for our baby is in tip-top shape. And a lot of times that includes just some regular exercise. It doesn't have to be extra strenuous. It doesn't have to be CrossFit. It doesn't have to be triathlons. It doesn't have to be any of that, just regular movement. A lot of us then proceed to jobs where, especially now, a lot of us work from home. So we're sitting just like we are doing right now, all day, every day. And even at a regular desk job away from home. So you have to remember to get up and move. They have those Versa desks now where you can stand. Even just that is important to avoid deconditioning, because a lot of us go from moving to the job. Now you sit here and this is what you do all day to get your job done, or in meetings, or flying all the time, or whichever one. So you have to be sure to focus on that. Balanced nutrition. So macros, ensure you have the appropriate amount of protein, and that's something you have to discuss with your doctor. I can admit that was not anything I ever thought about in young adult life. Just didn't. Feel like I had decent eating habits. Of course, medical school and residency and all that kind of stuff is a different story, but I never thought about macros. And the fact that you have physicians out now that will give you that breakdown of information. It's just another tool that you can use to try to stay close. Again, not perfect, just
Right.
perfect. And then calcium and vitamin D levels, making sure those are appropriate. There are recommendations for supplementation. Of course, we always want to try to get that through our diet, though. If we can get it through our diet, that's ideal. Regular checkups with your physician usually will include blood work to see where your levels are. And if your levels are low, my recommendation is to supplement to help maintain your bone health. That, again, one of those things you just can't control as we get older. If there are things that are wrong, that have been determined wrong, meaning you've injured yourself, now you have an unstable knee, or now you have a unstable shoulder or something like that, seek help. Go see your go see an orthopedist. It is not, and I repeat this over and over, it is not always that if you see a surgeon, you need surgery. Like, that's not really how it works. If you see a surgeon, the way I explain it to patients when I send them to, say, another surgeon for a procedure that I don't, go see that surgeon so you can get the gamut of information that you need regarding that particular problem. And that gamut usually goes from 0 to 10. 10 being surgery, 0 being this is what you have, this is what you can how you can manage it without surgery, et cetera, et cetera. And then all those things from 0 to 10. So it's information, basically. But if you do have something that is that has a surgical indication, it behooves you to try to get those things corrected early, because ligamentous damage, instability of the knee, they lead to other problems, lead to arthritis later. They lead to things that will prevent you from being active, even on a low level, as you get older. So consider corrective measures to allow your joints and bones to live in a healthy environment. That's the best way to put that, because they will show back up later on and with more issues. Pregnancy and postpartum, I don't see a lot of these patients, not on purpose anyway. The ones that I do see usually are having some level of skeletal issue during pregnancy. Like, a lot of people develop carpal tunnel, hip pain, pelvis pain, things like that. A lot of those things will go away once pregnancy is over. So again, when people come see me, we're having a discussion. It doesn't always mean surgery, but it does mean education. Of course, my OBGYN counterparts likely agree that some movement during pregnancy, as long as it's safe for the parent, for the mother and the child, is very important in order to prevent any postpartum issues that come along with having little ones. So monitoring for pelvic pain and diastasis recti, because that changes the types of activities that you'll be able to do after you're pregnant. So just being in touch with your provider and seeking help when you need it during that time, because things are very different in your body than you. Again, I've not been pregnant. I just heard about this and I've read about it, but I know that the body changes drastically. Some
Yeah.
things go back to normal. Some things will never be the same. So seek the information that you need from those that can give it to you to prepare yourself for whatever may be different in your body. So when that's over, you can return to at least some level of activity and movement, even if it is elitism or if it's just daily walks or your normal activities. Perimenopause and menopause. Now, this is where I am right now in my life. Okay.
Yeah.
So, again, which is the staple of this conversation, maintaining movement, despite the fact that you're super tired, despite the fact that you don't want to do anything, despite the fact that everything else in life is coming at you, because usually this is now, like we talked about, when you need to, I'm thinking 45 to 60-year-old perimenopause, menopause people. Sometimes that's a little earlier, but just in general, everything is coming at you. Maybe you're taking care of your parents now. Maybe you're continuing to take care of your children, taking care of grandchildren. And time in 24 hours doesn't change. You still only have 24 hours in the day. So again, a couple of times a week, try to participate in resistance training, weight bearing exercises, aerobic exercises, and balance exercises are super important because again, our bone health is starting to change. So any reduction in fall risk, we need to try to take advantage of. So balance, exercises, flexibility, muscle tone, all those types of things, which are easier, quote, to participate in as we get older because it's not so rigorous. We're not talking about doing a ton of weightlifting and things like that. So just enough to keep you on track. Then as we get older, over 60, preserve your mobility, so flexibility, prevent falls and prevent fractures. So if you think about it, if you've been doing the things that we talked about this entire time, then hopefully you've already set yourself up to have a better chance against falls and fractures because your bone health, your balance, your strength, all that is as optimized as it can possibly be. And again, as optimized, not perfect. We've done what we just throughout this time. Then you want to participate in even lower impact activity, cycling, swimming. I encourage swimming all the time. Swimming is
Yeah.
great. It's non-weight bearing. It still keeps your joints moving. It keeps your heart and lungs going. So if you can swim, cycling, walking, all those things, people really do, in my opinion, start to feel less than. I used to run 5 miles a day. So, can't do it now. So they just don't want to do anything because they can't do that. And I'm always like, if they're ever going to tell you not to do anything as an orthopedist, unless you're broken or I just fixed you or something like that, I'm always going to tell you to do it in moderation. Instead of doing 5 miles a day, maybe do 5 miles one, walk, swim, bike, bring yourself back around to that 5 miles. Because if your body, first of all, you're in my office. First of all, you're in my office. So something is not right. Something is bothering you. So you have to listen to your body. And there are ways, as we've been stating this entire time, where you can make progress and it not be perfect or in your mind perfect, meaning change up your exercise, do things differently, doing step aerobics, do Zumba, do, all these types of things that people don't really consider sometimes as movement and exercise, they all count. So a lot of what I do in my business is education. making sure people understand what they have in their power, to go to manage these things that are bothering them and to go through and make choices because it really is the external things that you can manage. It's about the choices. Some people don't know what options they have, which is where you're going to come in. We're talking to them about the things that they can do to build bone strength, bone density, maintain their muscle strength, maintain their balance. Overall, for everybody, 12 to 60 plus, prevention of sedentary time or avoiding extended sedentary portions of your day are really important. Just get up and move. Okay, if you have to set your watch, and I think they have those watches now that'll like buzz and tell you, hey, get up, you gotta move. Take advantage of those things. If you're in a caregiving role, it's even more important because you will lose yourself in taking care of everybody else. And as women, we are really by nature this way, where we dive into everybody else's issues and try to fix everything else. And then at the end of the day, it's almost midnight. You have 10 minutes for yourself. So you have to schedule it sometime. And it's okay to miss a day. It's okay to miss a mark if you have the overall structure in place because we're all going to miss the mark sometimes. Things that people also ask me about, very important, shoe wear, where you exercise, where you participate in your activity. All those things make a difference because if you're not comfortable, you're not going to do it. So if that means having to find the best pair of shoes, which is not the same for everybody, then do that. That doesn't necessarily mean they have to be super expensive or anything like that. If you're like, my feet hurt when I do X, Y, and Z, then explore that so that whatever you're doing is more comfortable. And if it's more comfortable, you'll likely do it more often versus dreading the situation. If the gym is not your thing, there's plenty of stuff now in our day and age. You can YouTube a chair exercise video, work at home, do everything in the privacy of your home where you don't even need any equipment. So even those things, no, maybe not, does not look perfect to you, but it's movement and it's progress and it's things that you can offer yourself to do, especially if you know you can't leave home because your elderly mother is in the other room resting. You can't leave. So let's find something to do at home in the other room that allows you to be at two places at one time, if you will. And again, modify. If you start to hurt, joint pain, muscle pain, think about it. Maybe I should be doing something differently. And if you can't figure it out, ask somebody so that it doesn't become a roadblock for you. Or I can't do that anymore, so I just don't do it. That's probably shouldn't be the mindset. So
Yeah.
that's me. Did a lot of talking there.
Yeah. Yeah. But let me just a couple of things, or maybe a few more than just a couple of things that you said that I think that is important, which is, when we are younger, we're not necessarily thinking about doing things to take care of ourselves so that we are healthy and functional when we're 60s, 70s. Unless there's something already going on with our bodies. I have a congenital back issue. So when I was a teenager, I would cry in pain. My story is very different because at a very young age, yes, I would run, but I really learned that I needed to take care of my back where for me, I barely work sitting because of that. It's so much easier. And now if I do long driving, anything that is long driving will exacerbate my back issues. So even recognizing that where when I was an adolescent, maybe driving wasn't an issue because I was not doing it. And then when I was in college, I used public transportation in Puerto Rico. And even when I was in Providence doing my fellowship, it's a small town. So I would walk and bike and short distance because of the traffic.
It's a long time in the car.
Yes. Yeah, lately what I have been doing is anything that is less than 5 miles from where I live, I'm like, can I go biking? Can I a short bike ride? And that has been besides I continue to do my yoga and that sort of thing, but that has been something that has helped me. So when I share this personally is also recognizing that there might be certain problems or conditions that you have that need to be taken care of differently as you move throughout life and different stages of life. The adaptability within that, I think that is very important. But I also love that you said, in every phase, like move. And a lot of the times patients ask me, so what type of exercise, which one is the best? And I always tell them the best is the one that you're going to
What are
do.
you gonna do?
Because if I tell you, I don't know, to do HIIT and go to a gym and do CrossFit, and you're like, oh, they're not going to do it. So I think that is very important. Understanding, so one, what you have access to. Not everybody has to pay a gym membership or go to an elite CrossFit studio. There's nothing wrong with that. But if financially that's not accessible to you, that should not be something that you see as a challenge, because there's other things that you can do that can keep you physically active and allow your joints to move that just do not require that amount of money. But also, I remember during COVID when everything shut, one of the ways that I would do physical activity, and it wasn't so much because of the exercise, I just needed something to do. So I would see my patients in the morning, and then what I found of like lunchtime, which was not, you know how it is, it was not an hour,
Yeah.
especially not during COVID. But I remember I would put a meditation app and I would go to the roof of the multi-level parking lot. And I was just literally listen to my meditation for less than 10 minutes, but I would just do circles, right? So literally what I was doing was going up the stairs of the multi-level parking lot, doing a circle, then coming down. But I was physically active, but then it also helped with everything else that was going on during that season. So again, that adaptability where, so when you are not in control and the world shuts, how can I still do things that are going to be beneficial for me? I think that is extremely important. And definitely, I am a big proponent of swimming because you can literally do it, even if you're pregnant, right? Postmenopausal at any stage. If you're having pain, I say try to look for something that is like heated. That's very easy here in Houston. But I think that again, the capacity to, be flexible, try different things, cross-train, which you mentioned, are all things that can, a lot of the times people focus on fitness or exercise because they're thinking on how their body's going to look. But I think that the more we speak about these things in a way that we understand, it's not only how your body looks, but what is happening in your body that is going to sustain health, mobility, independence, right? So
Yes.
that when you're in your 60, 65, when you have grandkids, that you can bend down, grab your grandkids, that
Right.
sort of thing. I think that those are the things that we also need to think about when we are talking about exercise. So beyond how your body looks,
Right.
I love that your message is there's no stage or phase in the woman's cycle cycle where you cannot like move, right? Maybe, yes, if you had a major life event that your body is healing. And even like that, it can look very differently, right? Because as you said, you can even be on a chair and I don't know, doing older exercises or bicep curls or so there's all things that can be done. And, the importance that you also emphasize, so ask for help. 'Cause yeah, we need motivation. And sometimes we just do not know because, yes, there was this major life event that now everything changes. And again, not everybody necessarily needs a personal trainer all the time. But I think that there are moments that when things in your life have changed, health wise, or not only health wise, I think that also when you
Yeah.
have life events that affect like time, those sort of things, working with a trainer or with a coach for a little bit that can like tweak things might just keep you going. So all of these are like great advice. When you think of like women, and this is probably for time purposes, really the only question that I'm going to ask you. But when you think about women, I know that you mentioned younger, you emphasize a lot like the sport injuries, repetitive sport injuries, the older having hip fractures. But maybe outside of those, like to younger, repetitive sports injury, post-menopausal hip fracture, is there anything that you see in between of those two cycles that you just see more often in women that you're like, you know what, girls, you need to be careful with this?
Yeah. I wouldn't say that I would say you have to be careful with it. It's more of an awareness. As we get older, our cartilage is going to wear out. Period. Point in blank. You do not get any more of it. It does not heal itself. It's like my analogy is the adult teeth. Once you chip it, it's gone. You don't get any more. So that's why arthritis is such a big deal, right?
Mhm.
So people come in and they're like, "Why?" And I'm like, "How old are you?" And the more birthdays you have, likely the more your cartilage is gonna wear. You're gonna be more. It's gonna wear more in your bone. I'm sorry, in your weight bearing joints, knees, hips, low back, things like that. If you have an injury at any point in your life to a joint, one of the things that we counsel is that more than likely this joint is going to be more susceptible to developing arthritis than it would have if you had not, or sooner than it would have if you had not injured the joint. That's one of those things that we make sure to let patients know, because you may have an ACL injury when you're 20. Get your ACL reconstruction. Part of the injury pattern that we see with ACL injuries is that we usually end up with cartilage bruising, cartilage fraying, cartilage cracking, however you want to talk about it. That cartilage is not going to heal itself. It is not.
Mhm.
You reconstruct the ACL in order to make the environment of the knee safer and the environment for the cartilage safer, so that you're not giving out all the time and your joint isn't injuring the cartilage all the time. But it doesn't make the cartilage better. Now, do we have answers to try to make a cartilage situation better? Yes, we do. But the bottom line is your natural cartilage does not heal. It is not like
Mhm.
skin or bone or hair. It just isn't, it's not, which is why, again, arthritis is such a big deal. So the one thing that I see is, as all ages, not all ages, that age group that we just identified, they come in and they're starting to have these kind of wear and tear issues, just because they have been active in the past. They're still active. Why is my knee hurting now? Et cetera, et cetera, et cetera. And people need to understand that cartilage wear is going to happen. It just is. Doesn't mean you're doing anything wrong. Doesn't mean there's something else that you could have done 10 years ago to prevent this from happening. Usually injuries are not something we could have prevented. That's why they're called accidents or injuries. I like to encourage folks to keep moving even though you have arthritis. And that's really when it makes good sense to come in and talk to one of us, because we can give you that information. Yes, things like keeping your weight under control can help to maintain your cartilage. But even I explain to people that have maybe been heavy majority of their lives, and then they lose weight and they want to know, are their knees still hurt? And I'm like, you can't undo whatever happened with cartilage during that time. The cartilage is still a problem. Your symptoms may not be as bad because they're not having to carry around the same amount of weight, but you can't
Mhm.
go backwards on your cartilage.
Yeah.
Can't. It's not possible. I think once people understand that, they go, okay, so this is what I have.
Yeah.
And then we talk about how to maintain the symptoms or control the symptoms, and then talk about the natural history of arthritis. When again, I said, that's one of the other things I was saying. I have a lot of time with my patients now, especially since I'm in private practice, to just have those conversations with them and educate them on what's going on in their
Mhm.
body. And usually that alone makes people just be able to tolerate things and feel better, move through discomfort, because they're like, okay, I'm not hurting myself. It's okay. et cetera, et cetera. So I probably would say joint wear and tear, just because we're getting older, or if you have a special something that happened to you in your past, we can put those things together. Okay, this happened. This is probably why you're here right now. First, your best friend is not, because
Yeah.
they didn't have this happen. Cartilage wear.
Mm. Good. That's a good one. And that's really a good one. And one that I think that is not spoken about as much as like bone health or muscle mass, which has become also one of the like newer things that the health and wellness industry is talking about. Thank you for bringing that up. So you mentioned at the beginning of the show a little bit about you do home visits, the type of patients that you are seeing. If anybody that heard this conversation is in need of an orthopedic physician, somebody to help them with their bone health, and they're like, oh, I think that she is a smart physician, and I think that she should be my doctor, how would be the best way for them to contact you?
So my website, w.drshawn, SHAWN, MDortho.com, has several different options to contact me. You can contact via phone. There is an inquiry form on the site that you can complete, and we'll reach back out to you. You can also have your physician visit that site and do a referral that'll come to me. The one that I offer is a telemed triage. And what that does for the patient and for myself is that we try to figure out if I'm the right person for you. The telemed triage is just a flat $50. Get 15 minutes on the phone with me to talk about whatever your issues are. And the reason I think that is important is because patients see orthopedists and will stop at that, and they may come to me for something that I do not treat definitively. Cervical spine issues or back issues or whatever. And so what I really dislike is waste and abuse. So I don't like to waste people's time. I don't like to waste people's money. So I offer that, and you don't have to have imaging or anything like that. It's just a discussion. Say, tell me what's going on. Let me see if I'm the person for you. And then we can dive into if I need to order images, if I need to make a plan to see you in person, those types of things. And I'm not sure who else offers that. I do. It's just a conversation. It's kind of like a curbside, but you're getting it with me. And you don't, it's not any pressure. We're just having a conversation. If you're having some pain or aches, have questions about, even if it's just a conversation about maybe something you've discussed with another provider and you just want another sounding board for that. I get patients for second opinions all the time, just to have a discussion because maybe they didn't have a thorough enough discussion with their prior physician, and they just want to
Right.
make sure they're missing anything. And so I offer the home visits, telemedicine visits, and I've seen patients at their physical therapy locations. I've seen patients at their primary care doctor's location. And then I have a couple of areas where I do sublet, where patients can come see me there in Sealy and in Katy. Lots of different options for folks if they want to reach out. I also have IG, Facebook. Those things are not as,
Yeah.
for me, I'm working on developing those things. I have some people helping me develop those things, but my website is probably the best way to go. And then you can also find my IG and my Facebook through my website. But I think we can all attest to social media being not what we trade on. When we were in school, you talk about a learning curve, and that's definitely it for me.
There you go. So thank you for sharing all of that. For our listeners, I will put on the show notes Dr. Sean's website as well as her social media link so that you can get a hold of her just by clicking on the link, which I know that makes it much easier for everybody. But thank you for being here today, taking your time, discussing and talking about a topic that I know that there's a lot out there in the health and wellness industry, but I think that it is important to hear the perspective of somebody that when you see again the patients, it's because, as you said, something is wrong. Different than a personal trainer or even a physical therapist. When a patient comes to you, it's because something else has gone a little bit sideways and they need a
Mhm.
specific type of help. So, listening to your perspective of what are the things that we can do so that we can avoid seeing you, or that if we have to see an orthopedic physician, hopefully you see it because of something minor and not something major. Knowing that
And don't
not
yeah, don't
control
wait. If
everything.
you yeah, don't wait. If you and if just for the conversation, I think it's worth it, and the education, I think it's worth it. And then we can also guide your Google searches instead of your Google searches being fraud.
Yeah, yeah. Thank you. It was my pleasure. I will put everything in the show notes for our listeners. Thank you for being here. And I hope that this conversation had sparked some inspiration and also some nuggets of wisdom that you can take to you as you continue to move throughout your health journey. Until next time, thank you. Bye.